What is polycystic ovary syndrome and how does it affect mental health?
Of course, in gynecological practice, this is one of the very, very common syndrome one comes across. I'm married to a gynecologist. That way, I'm frequently referred some of these cases for handling associated problems. We are all well aware that we have a life cycle where certain changes happen, and particularly when we are talking about girls or women, well accepted concept is reproduction, menstruation, associated issues. There are different types of criteria are there, but the important issue is there are certain changes in ovarian function. People have documented certain cysts, maybe additional more or less maybe, and because of certain changes, whole lot of issues happen. One of the most important thing is actually, in fact, say when we are trying to talk about puberty and adolescence, there are a lot of things like maybe acne, some hair growth, or maybe eating disorders, and psychologically being little reactive, feeling sad or feeling high, and many of these type of things are common. We all attribute these are all like almost like adolescent related changes, but sometimes we need to differentiate whether it could be related to something organic, and that's where actually the gynecologist will elaborately evaluate the individual for any changes that are happening. So this is related to few of the hormonal changes which actually we see, maybe something like increased androgen like effect, and maybe because of range of things. Of course, one in the high headlines you mentioned about nowadays we are talking about eating and other related disorders, a strong association. How it is actually will look into. Plus, few of the other things are related to metabolic syndromes. This is something like maybe putting on weight and eating disorders to, in fact, mental health related issues. Each contribute to certain cluster of symptoms, which you call it as polycystic ovarian syndrome.